Good afternoon, everybody, and it's fantastic to be here. And I've just listened to Farah's presentation about becoming a surgeon, and there's some overlaps with my presentation. I'm going to talk about my journey to being an NHS chief executive in a trust and an academic health science network. And Farah was talking a little bit about her background and how she got to being a surgeon. So I've called my presentation Think Big, Start Small and Scale Fast. And as I talk through my story, I think you'll see why I've used those terms. And those terms normally would apply to innovation. Let's think big, but start small, prototype, test and scale fast. And I think I've done that throughout my career. So this is my career on a slide. And similar to Farah, I grew up in what we'd now call a disadvantaged area. I didn't know that. I was perfectly happy. Everybody else was in the same boat. No one in my family had ever gone to university. So I went to a school that sort of helped me to get good GCSEs, and then I did my A-levels. And I decided that I wanted to be an occupational therapist. So I knew that I wanted to somehow reach out and support people, and I wanted to be an occupational therapist. So I got my place ready to go away to uni, got my A-levels, but actually decided I didn't want to go. And why I decided I didn't want to go is when I was at sixth form college, I was given the opportunity to do a placement as an occupational therapist, and it upset me every day that I went to that placement. I felt that I wasn't making a difference to people's lives. I wasn't going to be any good at it. And nobody in my family had ever been to university, so they didn't see it as a big thing. So I went off to work in the civil service. And I went to work at the Unemployment Benefit Office, supporting people with money and claiming benefits if they'd lost a job. And I was really appalled at how people were treated, how the staff treated those people coming in to claim benefits. And after 3 months, I left. And I started to decide that actually my values are about treating people well and looking after them. So I moved to my next job, and I moved by default. Actually, I didn't know what I was going to. I moved into a council. So you see on the slide, I worked for 3 councils: Kirklees, which is in West Yorkshire, Rochdale and Oldham in the northwest. And I really loved working in councils. And when I look back over my career, I was working with people who were in difficult circumstances with housing, needed to claim benefits, needed some support in their daily living. And I was actually working with what we'd now call the social determinants of health, all those things that add up to making you feel healthy, to having a good well-being, and to having a good life. And all these things keep people out of hospital. Having a job keeps them healthy. So I was working with people and helping them to do that. And towards the end of my career in councils, I set up all the customer service sections for the councils. So I was working with people who had to claim benefits, helping people to claim leisure passes, helping them to get food parcels from social services. And that really set me on the journey to thinking about my career, and that I wanted to support people, and I wanted to be working in an area where I could build the service around the customer. And while I was at the council, I went on a women in leadership programme, and I loved my job, but somebody described it to me as a golden cul-de-sac. They say, you love your job, you've got to the top of the grade that you can be in, you're in a golden cul-de-sac. And I decided that actually I'd reflect on that and that I would move on and do something else. So I moved into consultancy. I went to a firm called Vantage Point, who were a national consultancy firm, and really learned in that experience. So I had to facilitate programs and events. I had to write winning bids to get work into the firm. And I trained as well as a life coach. I'd already at the council become a trained counsellor, and I trained as a life coach. And during all this time, I told you I didn't go to university. When I was 21, I decided actually I'd made a mistake and I wanted a degree. So I got a grant and I started on a degree, and I did a social sciences degree with a year in health economics. And I actually did that through the Open University, so I couldn't go to a prestigious institution. I had my own house at 18. That's what I did when I got the job, and I needed to support myself. So I did my degree for the Open University and met lots of people. So after Vantage Point, I came into the NHS, again working with my values. While I was in consultancy, very sadly, my brother had died at the age of 31, and he'd had HIV for 10 years and had got AIDS and died. And I did feel that his treatment by doctors actually was absolutely fantastic, but by some of the other staff in the NHS, the treatment wasn't too good. And I decided I wanted to come into the NHS and felt that if I could make a difference to even one life, then it would be worth it. So I came into the NHS on a scheme called the Gateway to Leadership scheme, and it was a really fantastic scheme that pulled managers in from other sectors into the NHS. So I started at Bradford District Care Trust, which was a mental health and social care trust, as the Associate Director of Modernisation. Didn't really know what I was doing, but got to realise that this again was all about customers, how we treat people, how we look after them. And then I moved on to an ambulance trust. I became a director of HR and operations at an ambulance trust. And during that time, I did my master's degree. So I funded it myself, and I did a master's in organisational change, looking at the difference in how we change managed in local government, the private sector, and in the NHS. So I then moved on to a mental health trust, and this actually was part of my plan. When I came into the NHS on the Gateway to Leadership scheme, it was all about getting to be a chief executive in 5 years. And I never thought I would get there, but I thought I would try. I had the aspiration to try and get there and to make the biggest difference that I could to people's lives. So while I was at the mental health trust, they sponsored me to do a doctorate. I'd had quite a quick career progression. This was a scaling fast, and the chief exec sat me down and said, I'd like you to stay here. What can we do to keep you here? So I took the opportunity to say, I work as hard as I can, and I'd also like to do a doctorate, and they sponsored me to do a doctorate in business administration. So I did that. I started out as director of HR, and I also became director of clinical governance, and I had to deal with a number of clinical incidents in the trust. So I moved from there, again, part of the plan, or the sort of plan, the very vague plan, to be a director in a big acute trust in Liverpool. And that was really good for me, actually, and we're seeing how an acute trust worked. I'd worked in social care, I'd worked in mental health, but I'd never worked in acute, and seeing how surgery worked, diagnostics tests, and just being in that environment. And I started thinking after a couple of years that really, actually, now I'd got these experiences under my belt, maybe I could apply to be a chief executive, still with my values of putting the customer first. And I applied for and became the chief executive of the Walton Centre NHS Foundation Trust, which is a world-renowned neuroscience trust, again in Liverpool, that did lots of research, and I was able to support them to be really innovative and bring new services in to the trust. I also chaired the Comprehensive Research Network at the time, and that was just taking an opportunity that came up and grasping it and applying for it. And throughout all that my NHS career, I was being sponsored to go on different programmes. So I went to INSEAD Management School and met lots of different people from the NHS who are still friends and colleagues that I bounce ideas off. I went out to Yale to look at strategic management across systems. I went to Harvard to be part of a module on organisational change. And I just grasped those opportunities. So I had a family. I did have support, so I was able to go and do these things, and I managed to grasp all these opportunities. So reflecting on that, what do I think are the lessons from the career that might be some things that you'd want to pick up and think about? So I think it's been advantageous to be curious and be a learner. I've always been a learner. At the moment, I'm learning Spanish, and I've just done a programme on women in the media, and I've got lots of things going on where I can learn at work. And I've just moved new jobs. I was introduced, I'm now at Leeds Academic Health Partnership, so I'm learning again in the job and bringing others with me in that curious journey. And I really like this quote about having a growth mindset. So don't go into something to be competitive. Don't just think, I want a slice of that pie. Try and grow the pie. So there's a lovely rhubarb pie here. I'm sad to say that I didn't bake it, but actually try and think about how you can grow things and be that generous person who works to improve services and bring people along with you. I've been really lucky that I've always been able to have great mentors, and I now mentor people, and I have a reciprocal mentoring relationship with a senior research nurse in London. So a mentor, I would say, is someone who's been there. They've got the benefit of hindsight, and they can give you foresight to think about how you move your career forward, how you might take difficult decisions and do things in the right way. For me, it's been really important to go where I can make the biggest positive difference to people's lives. And I think sometimes you will come across situations where you think, gosh, this is really, really difficult. If you can, go where you'll sleep on big decisions. So if you're going where you can make the biggest positive difference, sometimes that means that you're having to make difficult decisions. You're going into services that need some improvement. So if you can, sleep on a decision and give yourself some time and space, bounce it off your mentor, bounce it off colleagues who have been there before, to try and make the right decisions. And as I've said at the beginning of this, it's great to think big, but it's sometimes good to start small, prototype, test again, scale fast to make sure that you get the right services in place for people. And I really like the mantra of Satya Nadella, who was the chief exec of Microsoft. And Satya came in and turned his business around with the mantra about actually we can't know it all. Let's learn it all together. Let's grow the business. Let's learn together. And let's be that learning health system for us in the NHS and social care where we improve the lives of the poorest fastest. So what would have helped me? I told you a little bit about my background and how I didn't go to uni and nobody was really bothered about that. But it would have been really advantageous for me, I think, nowadays to be able to take advantage of some of the widening access and participation programmes that were about. And on the screen, I put the Health Education England work streams around this. And I know they've got a stream within the conference. So I am a non-exec director of Health Education England and wanted to do that alongside my current role, again, to try and make a difference to people's lives and bring them into healthcare careers. In Leeds, where I'm working now, we've got three universities all doing great things about widening participation. So Leeds Trinity University's got a great 5-year focus on increasing access to a range of students. So their catchments are the students within 1 hour or less travelling time to the uni, areas of deprivation, and they want to give wider access to people into healthcare and other careers, but they also want to make sure that when people get to Trinity, their attainment is as good right across the board, whoever you are, wherever you come from. They've had a 5-year programme and they've evaluated it really closely. There's a 25-page document if anybody wants to look at that, and thought actually we're doing well here with opening access, but our attainment level is the same for all students. And they've committed to a programme of supporting students, especially BAME students, at every level of the student life cycle to make sure they achieve. University of Leeds, where some of you might be thinking about medical school, they've got a massive widening access to medical school programme. It's designed and run by the student body. It's been going for 12 years ago, and their alumni support it as well. They run a summer school, they engage with sixth form students, and they have ambassadors and a mentoring programme. And I told you how important I thought mentoring was for me and would have been at this stage if I'd have been selecting a career in healthcare. On the slide, I've put the impact, and you'll see how their course numbers and the diversity of the course numbers of students on the course with diverse backgrounds have gone up radically over the last 7 years. So I think a final word from me: think about your values. Never think about any opportunity as a wasted one. If you go for an interview and you're not successful, think about learning the lessons. Through my career, I had lots of things that I thought, actually, that's been a learning point. I haven't badged it as a failure. I've just thought, that's a learning point. What do I do next? How do I pull out the lessons and move my career forward? Well, thank you for listening, and good luck in your choice of career.